the shoulders sink. Gentle, gentle. Down.
Like a brand new person.
Okay, Cece. All right, let's start with the easy stuff. Back pain, neck pain.
I do have some neck pain.
Tell me about it. How long have you had neck pain for?
I've had neck pain for about 3 months now, on and off. It tends to happen on my right side. I did recently get like a pinched nerve where I had to like massage it every day for a week straight and lay on my bed with a towel. And it did clear up.
Have you ever had that before? Is this the first time you ever experienced that neck pain?
No, actually, I've been having it almost all my life. It's just kind of where I hold my stress.
Mm-hmm.
So whenever I'm really stressed out, I will get so tight and knotty all up in here and then all through here. And it does cause some headaches every once in a while.
Okay. Once in a while, like once a month, more or less?
Like once a month.
Okay, very good.
And the headaches aren't too bad either. Like I can just take some ibuprofen or Tylenol or something and go about my day.
Okay. Do you think the once a month headaches are period related?
They could be.
Okay. All right, back to the neck pain. You said all your life. How far back can you remember? Like high school, did you have neck pain? Athletes, sports?
Yes, so I did grow up playing basketball and I ran track, and I also was in a bunch of dance classes. And I think my neck pain actually started when I was like 13 or 14.
Okay. Accident, injury, fall?
No, just a lot of sports.
Okay.
Yeah.
All right, so since 13 years old, what kind of treatments have you tried for your neck pain?
So I used to go to a chiropractor about once every 2 weeks or so, back when I was a child, and all the way up until I was 18, I believe. And that would really help the adjustments and stuff like that. Also getting normal massages.
Mm-hmm.
I was in a pretty serious car accident when I was 18, and I had to get some stem treatment on my neck and in my arm area.
For you, how about self-work? Do you stretch or?
Every so often.
Mm-hmm. Okay.
It's not the norm for me
Mm-hmm.
anymore.
Okay. Any more but used to be?
Oh yeah, when I was heavy in sports and stuff like that, or when
Okay.
I was really into my flexibility stuff, I would do a lot of stretching, a lot of yoga, but now I kind of taken that all in the back burner.
Okay, very good. The phases,
Yeah.
things come and go, that's fine. I invite you to allow them to come again. Yeah, it'll be helpful. Long term makes you see me or any other doctor much less when you stretch. You said I had a pinched nerve, so it was different than most pain that you've experienced.
Yeah,
Tell
I
me
couldn't
about
move my head at all. It was really bad. I don't know I know what I did. I was taking my bag and putting it into my car, and I had a ponytail in, and my ponytail got caught in the bag. And instead of me not worrying about my hair, I was worrying too much about my hair, and I pulled my neck in a weird way to not let it catch when I was tossing the bag into the car.
Mm-hmm.
And then it just tensed up, and it was like that for a solid week.
All right, did you have any pain that went down your arms? Any numbness or tingling in your fingers, hand?
Yes, actually. It was in my thumb and my pointer finger. It was like right in the tips. But that's gone now. Yeah.
Okay, very good. All right, do you have any other pain besides neck pain?
Okay, this is going to sound really weird. And I have no idea where this came from.
You have jaw?
No, it's right in here. I will get like... Because it's not like a tingly sensation. It's like real pain. And I could just get it when I'm laying in bed. It almost feels like pins and needles are just going at it.
Mm-hmm. Is
But
it
it's
deep
not-
or is it superficial?
It's pretty deep. And I don't know what I did to it recently, but I felt so bad yesterday. And I was like, did I sleep on it funny? Like every once in a while, I'll be like out of breath because it hurts so bad. And I'm like, oh. But I'm not limping. It's not like giving me any problems when I walk or when I sit too long. But when I'm laying in bed, it's like this pulsating, painful. I don't know. It's
Is it
weird.
your whole leg or is it
No,
one spot?
it's like it's just right in here.
It feels the circumference around it, or you feel it deep in
Yeah.
the middle? Maybe a little both.
Because I feel it up here and then I'll feel it down in here, but it's all in this general area.
Mm-hmm. Do you vape?
Yes.
Okay. Like nicotine vape?
Yes.
Okay, but this has only happened once?
Yeah.
Okay.
Yeah. Just started yesterday.
Oh, okay.
Yeah.
Well, what did you do the day before yesterday?
Nothing really. Nothing that would have caused
Mm-hmm.
anything like this to happen.
Day before that?
I don't think so. I mean, the most that I've done recently is walked around in Philly, and walking doesn't bother me.
Okay. Sometimes. Never know.
No,
But you
yeah.
could be dehydrated one day or have a weird shoe or have walk on a bunch of different angled streets that could cause something like that. All right, so that could be developed. The most important thing is tracking it. How much does it happen? You know, it's pretty new now, so there's no reason to do
Yeah.
anything immediately except for to make a note of it. That way you can have long-term tracking of it.
Okay.
All right. Well, otherwise it could be a couple of things, and we'll see. Maybe an adjustment in your pelvis will help out. Have you ever had any X-rays with that chiropractic care?
Yes, I've had, I think, 2.
But they're old.
They're, yeah.
Okay, that's
Yeah.
fine. All right. Do you have any other pain? Any ankle, knee, wrist, elbow, shoulder, jaw?
No.
This, I'm going to start off with an exam. I'm going to look at your spine, and then we'll get
Okay.
you adjusted. Okay.
Perfect.
Okay, looking at the feet first. Heel strike, mid stance, and toe off. It looks symmetrical mostly, if not just a little bit more eversion, external rotation on the left, but mostly straight on. Everything's coming down nicely. You really have accentuated toe lift off on the right side. That's interesting too. It's not there on the left. That's really the only asymmetry I see. No bowing of the Achilles tendon on the left, but just a slight deviation on the right. So definitely some definitely some ankle findings that may be translated to the hip. Yep, I see a little bit more on the left side forward this way too. Mostly symmetrical. I definitely have a high left hip significantly, and then the hip swings up on the left compared to the right. So maybe a restriction on the right. We can maybe see it from the back. No restriction to be seen, but it definitely has that kind of motion towards the left, favoring the left, moving off of the right side. Okay, looking at the shoulders, they look pretty close to even. It's most likely a high right shoulder from here, and then the occiput looks even too. Touch the bottom of your feet, okay?
You're ticklish, but okay.
That really? They're that ticklish? Oh my god, this is gonna be difficult. Are you ticklish like that everywhere?
Yeah.
All right, we'll work through it. All right, turn around and face the other way. All right, you're gonna feel my fingers on the top of your hips, okay?
All right.
Okay, here's the hip measurement. Let your arms relax. It's significantly higher on the left, so we'll see if that translates to a short leg. This is where a little bit more of a bow on this side. Not so much a genu varum, but definitely it's present.
Interesting.
All right, you're gonna feel my fingers on the back of your hamstrings, okay?
Okay.
And a lower glute fold on the right. So the right hip is back like this, and the left one is forward. Definitely low glute fold, high left hip. High left shoulder. High left hip, high left shoulder. Turn around and face this way again. Go ahead and close your eyes. Looking for postural sway here.
Well, it's gonna happen.
It does happen. Pretty steady, but just a little bit wants to move off to the right. Just a little bit. Okay, you can open your eyes, and then looking at your occiput. Pretty close to even. Your head's screwed on tight, that's for sure.
Thank God.
Muscle hypertonicity on the right side of your spine here. You're one side dominant for sure. We'll have to investigate whether this is hypertonic, ticklish, or this is hypotonic. We'll see. All right, I'm going to palpate your SI joints, okay?
Okay.
So I'm going to lower down your waistband just a little bit to the top
Sure.
of your SI joints. Okay, right or left is one more tender than the other.
The left hurts a little more than right.
Okay, S2 on the left. Okay, ready? Left or right is one more than the other.
Right.
S4 on the right. Okay, I'm going to Push into your lumbar spine. Any tension, discomfort here?
No, that feels great.
Here.
No.
Okay, let's turn to the left. Here, wait, hold on. Leave your feet flat and leave your feet pointed that way.
Okay, feet pointed this way.
Yep. Just turn to the left.
Okay.
I want you to compare that feeling there to this feeling here. About the same, huh?
Yeah, that's the same.
Right shoulder's a little stuck there.
Yep. I feel like that's always stuck.
Levator scapula. Can I do similar left or right?
Right hurts a little more than left.
That's
right there.
there.
Yeah.
Some right shoulder muscular stuff to deal with. Let's bring your chin to your chest. Good movement there. Upper cervical motion restriction. Let's do this. Bring your ear to your shoulder. This side. Range of motion's pretty good. What side feels more tight to you?
The left side feels a little tighter.
Going this way feels tight on the left or the right? You feel it
on
up
the
here
right,
like this? Okay.
Mm-hmm.
Okay, I'm going to dig into this a little bit. How are you with deep tissue?
I'm okay with it.
Okay, deep breath into the nose. Pressure's good?
Yeah, it feels good actually.
Is that too much? Pressure's still good?
Oh, it feels great.
Okay, we're going to go a little bit deeper this time, okay?
All right. That felt magical.
Okay, I hope you feel the same about this. Breathing.
Not as magical.
Gotta wait for the magic on this one.
I guess so.
Okay, I'm going to decide where to adjust your spine based on something called the trap fiber analysis. So this is what we do. I want you to tell me which one is the most tender. Ready? It's going to be 1 through 7. 1, 2, 3, 4, 5, 6, 7.
1.
1. That thing?
Yep, that right there. Whatever that is.
Okay, this tells us we need to adjust T1, T2, and T10. So let's do this. Ready? If I push here, that makes it better, doesn't it?
Yeah.
Okay, so we have to adjust T1. Here's how we're going to adjust it. Right, left. Which one? Right, left. Which one's more tender?
Right.
Okay, so we need to adjust this here. Let's go down to T10. Ticklish. Tell me right versus left. Okay, hold on. Okay, one more time. Ready? Right or left?
Oh, left actually.
Okay, T10 left.
Yeah, yeah.
Okay, let's start off with some easy stuff, okay?
Okay.
With just the middle of the spine. So nothing really is crazy going on here, but let's just practice an adjustment and start getting you loosened up, okay?
Okay.
We're going to start right here. As you breathe out, I'm going to follow your breath just like that. Can you let your shoulders relax a little bit more? Okay, very gentle. As you breathe out, we're going to go down in this direction, okay? Very nice. We're going to do that one more time. We'll follow this breath out. Good, gentle, gentle. You're going to bring your head over to the side like this, and then we push like that, okay?
Okay.
Good, gentle breathing. Okay, gentle, gentle. Bring this over here. You're breathing, and then I push like that, okay? Okay, let's try that. Deep breath in and out. Okay, deep breath in and out. Discomfort or tension when I push here into your lumbar spine.
Yes, actually.
Okay, what about this one here?
Just a little bit.
Here.
No.
Here.
No.
Here.
Yes, a little bit.
Okay. All right, let's do this. Keeping your leg straight, lift your right leg up in the air. Down, push down. Whole thing, keep it straight. High as you can go. Okay, down. That's good. Left. Down. Okay, again, right. Down. Left. Down. Did your hip just crack?
No, that was the bed.
No. Which side was more difficult?
The right side, I think.
Okay. That's good. Elbows in. You're gonna breathe in, and as you breathe out, we're gonna lean back, but hold the curl, okay? Okay, deep breath in. Go back as you blow it out. All the way down, all the way down, all the way down. One more. All the way down.
Wow.
Back, okay?
Okay.
Bottom leg is straight. You're going to bend the top leg like this. I'm going to scoot you forward just a little bit like that. Your arms are good. We're just going to fold them like this in here. Same thing like the other ones. I'm going to follow your breath. As you breathe out, I stretch your shoulders in this direction. I'm going to bring your hips down like this. Then I'm going to push, okay?
Okay.
Okay, let's give it a try here. Deep breath in and out. Good. Shoulders sinking in. Okay, lie on your back. That's bottom leg is straight. Top leg we're bending. Scooching it forward just a tiny bit right there. Okay, you're breathing. I'm going to hold your shoulders like this in this direction. As you breathe out, we're going to follow the breath down. Very flexible in your hips. Good. Scooch nice and gentle with the hips relaxed, shoulder. That's good right there. One more breath. And out. Gentle, gentle. Okay, let's do this. Go ahead and turn your head to the right. Back to center. Turn your head to the left. Back to center. Bring your right ear down to your shoulder. Center. Left ear down to your shoulder. Center. Okay, I'm going to lift up your head. I'm going to do one more test here. Let this relax as best you can. Nice and gentle, following your breath. So you see, we'll go in this direction like this. It'll push at the end here. Let's try that again. This shoulder sink.
Actually, that was great. That felt, yeah.
Gentle, gentle. Nice and gentle, following the next breath. You're good. Okay, good. Following the next breath cycle in this direction, like this, gentle, gentle. Okay, I'm going to pull down on your ankles in this direction, okay?
Oh, that's nice.
Good. Gentle breathing. Deep breath in and out.
Wow. I have no words. Did you just crack my lower back the whole way? Wow. That's lovely.
That was really good for you. There's like a billion cracks in there.
I'm so sorry. I'm feeling it more on my left side than my right. My right side, great. Left side, I'm feeling a little pain. It's like up in the middle, like my shoulder blade. On my shoulder blade. On the left side.
Okay. There's probably a rib there we'll need to check out. Okay, you ready for this to come down?
Sure.
All right, let's see, stand up. How's it feel?
I feel really loose now. Like a brand new person.
Good, let's relax. Go like this, hold your pinky and thumb together. Don't let me pull it apart. Push. Harder. Right side, push. Push. Alright, bring your chin down. Let's see here. I'm going to hold on to your elbow. I'm going to reach around the front, okay, and hold on to your elbow. Lean forward just a little bit like this. Good, relax. Alright, I'm going to test the front of the rib cage here, okay? Here's your clavicle right here. I'm going to move down. This is just the tips of my fingers. This is the first rib here, second rib head, third, fourth, fifth. 1, 2, 3, 4, 5. I'm going to go down one more here. Okay, ready? 1, 2. Which one? This is more tender here than here?
It's more tender up than it is lower. On this side. Oh, like right there.
This one off to the side. I'm going to put my hand underneath here, okay? Let that arm relax. I'm going to put my thumb right on top of that tender rib, okay?
Mm-hmm.
All right, I'm going to grasp my hand with my other hand like this. You're leaning back on me. Lean back onto my hip. Now lean your head back too.
Wow.
That's pretty good.
That felt really good.
Cracked right there, right?
Yeah.
You felt it, right?
Yeah.
Underneath my hand, yeah.
Yep. I don't think I've ever had that cracked before.
Of course
Ever.
you haven't. Yeah. Okay, I'm going to pull on your ears.
Oh, nice.
Okay, nice gentle breathe.